In 1920, there dawned in Kharadar, Karachi, an era of far-sighted public service with the foundation of the Janbai Maternity Home by His Highness Sir Sultan Muhammad Shah Agha Khan III. The Janbai Maternity Home was born of an extraordinary vision, a vision which expressed the importance of healthcare from the womb up. It was a revolutionary concept then, and almost a century later, it still remains a priority and a relevant concept. This initiative became the seed for the Agha Khan Health Services, which have today grown into a strong and sturdy tree with many and far-reaching branches, spreading the fruit of its many benefits to the underserved and the deprived on 2 continents. What does Agha Khan Health Services Pakistan stand for? There are many facets to this diamond of rare brilliance. It is a unique world of conviction and commitment, underpinned by an unshakable belief in the concept care is cure. Organizationally, the Agha Khan Health Services is part of the Agha Khan Development Network, a group of private, international, non-denominational agencies working to improve living conditions and opportunities for people in the developing world. The network's organizations have individual mandates that range from the fields of health and education to architecture, rural development, and the promotion of private sector enterprise. The Agha Khan Health Service Pakistan is a part of the nationwide Agha Khan Health Services network. This is a non-denominational, not-for-profit organization that strives to continuously improve health delivery services to the underserved populations. On the social plane, the Agha Khan Health Service Pakistan, as well as worldwide, is an agent of positive change, a harbinger of health, hope, and happiness. Beginning as an effort to improve maternity and childcare in the locality of Kharadar, Karachi, the Agha Khan Health Services has been instrumental in lowering the morbidity and mortality rates during childbirth, as well as infant mortality rates. The service has also been instrumental in improving the general health indicators of the under 5 children in the areas it serves. The service reaches out to more than 1.5 million people, mostly in rural areas and remote areas of Pakistan, and also to low and middle-income urban dwellers. In consonance with the latest advances in community development and care, the service has dedicated itself to the realization of the Millennium Development Goals adopted by the United Nations in 1990 and is actively engaged in enhancing Pakistan's progress towards the attainment of these goals. This alignment of its efforts with the international objectives makes the service a provider of necessary care and health education to the underserved, underprivileged communities, and thus involves them in efforts towards improving their lot. It is an acknowledged fact that poverty breeds ill health. Ill health feeds poverty. The Agha Khan Health Services Pakistan helps communities break this vicious circle. Of great importance are the giant strides that the service is making in enhancing health issues awareness. Trained and committed lady health visitors and community health workers take general health issues as well as specific subjects right inside the homes of the communities they serve. This concerted focus on lady health workers also serves the realization of other Millennium Development Goals, the education and empowerment of women. The women of the households are natural caregivers. Educating them, especially about basic healthcare needs by itself, raises the health standards of the community. One cannot estimate the amount of suffering prevented and the savings in monetary costs to society by this raising of awareness. In fact, these awareness-raising activities are freedom on the march, empowerment at its best. They lead to liberation from ignorance, the root cause of most social and physical ills. One of the most important aspects of Aga Khan Health Services has been its stress on the development of localized community human resource.
मैं 1998 में एज ए लेडी हेल्थ विजिटर ज्वाइन किया, फिर मैं 2 साल लेडी हेल्थ विजिटर के तौर पे काम करने के बाद मुझे आगा खान हेल्थ सर्विस ने स्पॉन्सर किया और मुझे आगा खान यूनिवर्सिटी भेज दिया गया नर्सिंग में डिप्लोमा करने के लिए। मैंने 3 साल डिप्लोमा किया वहाँ से, फिर मैं वापस जब आई तो मुझे इस फैमिली हेल्थ सेंटर में ट्रांसफ़र किया गया। मैं यहाँ पर एज ए कम्युनिटी हेल्थ नर्स काम कर रही हूँ।
Empowerment again. Enabling people to think for themselves, to recognize problems, to devise solutions. Purposive efforts at empowering communities is again a novel concept. It enables people to break free from the straitjacket of the conventional, institutionalized professional healthcare provider model. In most cases, reduces response times and thus immeasurably contributes to the alleviation of human suffering. In the early stages of the service's outreach program, trained social volunteers from Karachi, imbued with a pioneering spirit and missionary zeal, took upon themselves to brave extreme weather conditions and inhospitable terrain to help their brothers and sisters in need. These social volunteers attended to immediate healthcare needs, providing immediate relief. Working in conjunction with local community elders, they also trained corps of local volunteer health workers who eventually became their replacements in the communities they served. These capacity building activities also serve as an example and sure route to women's development. They encourage participation of local women in community concerns, bring them into the ambit of trained healthcare providers, and make it easy for tradition-bound community women to discuss personal health and hygiene issues with them. The key to the Aga Khan Health Service Pakistan's remarkable success has been the breaking down of the barriers of inertia, making target populations amenable to acceptance of suggestions and recommendations. With this comes a broadening of horizons in the communities it serves, an enhanced awareness and a realization that individual health is a collective responsibility. While many milestones have been achieved, the journey continues. While the Aga Khan Health Service Pakistan strives to support achievement of Millennium Development Goals each day, communities present specific, unique challenges. The Aga Khan Health Service Pakistan views all challenges as new opportunities to provide still better care, remains at the forefront in the struggle against disease and deprivation in consonance with its motto, care is cure.